These are some of the PACES courses that you should know about before attempting PACES. Hello, hi, I'm Dr. Nura, one of the GP registrar here in North Wales. I have passed my MRCP in 2019. As we know, courses is very important. A lot of people attend courses before going for MRCP PACES. I wanted to let you know about few courses that's available, free and also paid. So the first is the free Deanery PACES course. So this is PACES courses which are provided by the Deanery and is always free. Normally they do have some criteria, such as you have to pass your first part of MRCP part 1 before going on to this course, but you just need to book and it get filled up very quickly because the fact that it's free. In Wales Deanery they call it How Not to Fail PACES course. It's such a great course. I did it twice. First was during my first year of core medical training and the second was the second year of my core medical training, and the first one I did was in Prince Philip Hospital in Llanelli. It's held within the weekends and the course is completely free. You only have to pay for the accommodation and transport, and even that I think you can claim from the study budget. During the first course that I did, it was 2-day weekend. The whole day, Saturday and Sunday, we rotate in groups going through all the different PACES stations. There were 6 persons in each group, 4 stations per day, and each station lasted about an hour and 40 minutes to give enough people ample time to actually examine the patient. Each station has 3 patients to be examined, and then there were 2 history stations, and there were history stations with 2 scenarios where people just take turns going through the history taking. During the communication station there were 3 scenarios as well. And then the second one I did was in Glenclwyd Hospital. Again, it was held over the weekend, the whole 2 full days. It started with some lectures going through what PACES is and how to approach PACES. After some talks from the PACES consultants, then we go through each station and we just rotate all the different stations. When we rotate, we actually become the participant PACES as well, PACES candidates, and we actually have to simulate real exam scenario where you have to examine the patients and actually present the findings. So exactly just like PACES. They also give you feedback. They actually mark during the mock station, they also mark you on it and they actually give you feedback as well. For Welsh IMTs, they provide the PACES course twice a year, taught by experienced PACES examiners. They are subject to availability. The courses is such an amazing opportunity as it's completely free. All the consultants who are involved in these courses are usually PACES examiners, and then obviously after we've done our PACES candidate mock exam scenario, then they go through the findings with us. Now these patients that they brought to this course are actually, they have this pool of patients, a list of patients with a very good clinical signs, where they pick these same patients for exam as well. This is the list of patients where they pick the patients for the courses. So it's a good opportunity to actually hone down your skills and see what clinical findings and then know what to look for, because these patients actually usually have excellent clinical findings. I think some of the cases that I saw during my first course in Prince Philip Hospital was CREST syndrome, the history multiple sclerosis. At Glenclwyd, I saw a patient with neurofibromatosis, patient with neurological findings. The second course that I went, because after attempting the PACES and failing for the first time, I realized that I'm very weak in neurology. There's the NeuroPACES, which is held by the Walton. So it is called Walton Center Clinical Neurology PACES course. Now this course is excellent to hone down the neurological examination, findings, what to look for, how to interpret your findings, and how to present your findings at the end of the PACES station. It is 1-day course and intensive. About 30 to 40 candidates can attend. It's a very oversubscribed, so you need to book your place as soon as if you want to attend the course. The course always have excellent feedback, about 90 to 96%. Rating the course as excellent, very good. It was. I attended myself, and it has a wide range of critical neurological cases that's likely to be encountered in PACES. And this is the time to see all the weird and wonderful neurological cases, because in my hospital we don't have a neurological ward. We only have this usual stroke cases or occasional special neurological cases. But this is the time for you to see all those sorts of neurological findings, because they're all gathered into this this 1 day full day course. Normally we have teaching in the morning to start with, how to approach neurology station in the PACES, how to present our findings, what does the findings means, and what are differential diagnosis. And then we are broken down into groups, so normally about 4 to 5 people per group, which is just a small number, and then we rotate around all the different stations: upper limb, lower limb, cranial nerve, eyes. Each candidate actually has enough time to do examination during that day, so we go each station and all 5 of us take turn to examine the patient. There will be a neurology doctor there as well. He or she will go through all the clinical findings and how to approach the examination as well. This course actually allows you to examine and observe the weird and wonderful neurological cases that you're likely only heard about but not seen, which will be useful if you're not exposed to a lot of neurological cases in your hospital. I had the opportunity to compare a normal neuro exam and abnormal neuro exam. As I've seen a lot of abnormal findings, now I know what to look for. The next cases is the PassPACES course. This is the most popular PACES course. It's a very expensive, but also people have sworn by it. I did not go for this course purely because of the cost. It is very expensive because it's more than the exam itself. However, if you compare, like if you're going through the PACES like few times, you know, keep failing and failing, then maybe it's worth it to just attend this course and pass it on the first try, because I know a lot of people have done that. It is in London, so you have to travel and book accommodation there. They used to have neurology/ophthalmology course, which initially I was thinking of attending, but I don't think they have it anymore. It's a 4-day MRCP PACES clinical course. They have the neurology, ophthalmology day, cardiorespiratory day, and then they have 5-station mock exam with individual feedback, and then small group clinical skills teaching. They demonstrate the exam techniques and station 5 as well. The next course that I've received email and heard about is the Cardiff PACES course. So I received the information from the deanery email and I've heard a few good things about it. I did not attend this course. It's a 3-day course which offers balanced feedback about examination technique and presentation, history, communication skills, and seeing clinical signs. They also have like realistic mock exam as well to prepare you for the real thing. It's suitable if this is your first attempt or you want to improve your overall examination skills and chances of passing. It is often little things which matters in the exam, and it says that MRCP is not difficult exam, but it's very easy to fail the exam. The people who organizes the course is very experienced with teaching. They have consultants and senior registrars based at the teaching hospital in South Wales who teach on the course. There's a limit about 6 candidates per group, which ensures that everyone gets individual attention, and it's about £900. Now the rest of the courses that I've heard but I haven't heard much about it are PACES for You and PACES Ahead. So I'll put all the links of these courses at the description below so you can check it out. Anyway, overall the courses can be helpful because they provide focused teaching on the techniques to pass the exam. They provide a mock exam. They can give you feedback. They assess your techniques and correct your techniques before going for the exam. They are taught by real PACES examiners, and the patient have very good clinical findings. They do cost a lot of money, but they are free ones, which is the one organized by the deanery. So I would advise to book yourself into the deanery PACES because you don't have much to lose by attending this free PACES course. And obviously the one which paid PACES course, it can be very useful, especially if you keep failing, and if you compare failing twice, it's already, if you go for the course, then probably you will get your money worth if you just go the course and pass it first time. Nevertheless, they provide such good value. You have the chance to actually examine all these patients with weird and wonderful clinical signs all in 1 or 2 days or 5 days. Probably best to just attend this course near to the exam so that you don't forget what you learned. And my advice is identify what your weak spots are and then work on them. So if you feel that you're weak in neurology, then Walton NeuroPACES is good, or if you want like overall, then obviously the rest of the PACES course is good. I feel that definitely the deanery course is worth attending because it's free and done by the PACES examiners. So good luck for your exam, and I hope you pass. And if you have any questions, then please leave a comment down below, and I'm happy to help and I'll answer your questions. So don't forget to watch this video next on tips on passing your PACES exam.